After age 60, your bones begin to lose density much faster than when you were younger. Many people believe that simply taking a lot of calcium will prevent osteoporosis. But in fact, if supplemented incorrectly, calcium can harm the heart, kidneys, and blood vessels. Today, we will learn calcium after age 60, friend or foe. Part 1. Why is calcium so important after 60? After age 60, the process of bone destruction occurs faster than the process of bone formation, causing bone density to decrease and bones to become more brittle. In postmenopausal women, the decline in estrogen causes bone loss to increase rapidly, increasing the risk of osteoporosis and fractures. In addition, the body at this age absorbs calcium less well due to the decrease in stomach acid, making calcium difficult to dissolve and difficult to absorb. Vitamin D levels also decrease because the skin synthesizes less. There is less exposure to sunlight, and the kidney's metabolic function is weakened. Some drugs, such as stomach medicine, corticosteroids, or diuretics can reduce absorption or increase calcium excretion. Lack of exercise also prevents bones from receiving mechanical stimulation to strengthen their structure. The recommended calcium requirement for people over 60 years old is from 1,000 to 1,200 milligrams per day, including from food and supplements. The body can only effectively absorb about 500 milligrams at a time. So if taking supplements, it should be divided into several times a day. Calcium from food often comes with many supporting micronutrients such as protein, magnesium, potassium, and vitamin K, so it is better than just taking pills, which puts a large amount of calcium into the blood in a short time and can put pressure on the heart and kidneys if taken in high doses. For calcium to be effective, it is necessary to combine vitamin D to open the door of absorption, enough protein to create the skeleton, magnesium to participate in bone structure, vitamin K to attach calcium to bones, and weight-bearing activities such as brisk walking, climbing stairs. Lightweight training, on the contrary, the habit of eating salty foods, smoking, drinking alcohol, drinking a lot of carbonated soft drinks, or consuming too much caffeine will cause the body to lose calcium faster. A sufficient daily calcium intake can include 1 cup of milk or yogurt 300 milligrams, 1 slice of cheese 150 to 200 milligrams, a portion of sardines with bones 300 milligrams, 100 grams of tofu made with calcium sulfate 200 to 300 milligrams, and a bowl of dark green vegetables such as kale or broccoli 150 to 200 milligrams. In tablet form, calcium carbonate contains a lot of elemental calcium, but needs to be taken with meals for good absorption, while calcium citrate is easier to tolerate and less dependent on stomach acid, suitable for the elderly or those taking stomach medication in any case. The dose should not exceed 500 milligrams per time to optimize absorption. Calcium supplementation should be considered when the diet is inadequate despite improvement, when vitamin D deficiency has been treated, or when there is a diagnosis of osteoporosis or a high risk of fracture as prescribed by a doctor. Part 2. When calcium becomes a traitor to health after 60, calcium supplementation is not always good. Many studies show that taking high doses, especially over 2,000 milligrams of elemental calcium per day, can increase the risk of kidney stones because the kidneys have to filter too much calcium and deposit it into crystals. In addition, sudden increases in blood calcium can contribute to the formation of atherosclerotic plaques, causing narrowing of the arteries and increasing the risk of heart attack or stroke, especially in people with cardiovascular disease. Several studies in the US and Europe have shown that calcium supplements in pill form without vitamin D and without proper dose division, are associated with a higher rate of heart attack than those supplemented only through food. This does not mean that calcium causes heart disease, but it shows that the body processes large amounts of calcium in a rush from pills differently than it processes calcium from food, which is absorbed slowly and has many protective nutrients. In addition, calcium supplementation without considering other factors such as vitamin D status, exercise regimen, or protein intake can lead to false excess. High blood calcium not entering the bones. Part 3. How to supplement calcium safely and effectively after 60. First of all, prioritize calcium sources from food. Low-fat dairy products, small fish eaten with bones, tofu made with calcium sulfate, dark green vegetables and almonds. If you need to supplement, choose the appropriate form carbonate or citrate depending on your digestive condition and the medication you are taking. Always divide the dose into smaller doses of less than 500 milligrams at a time for better absorption, and take it with vitamin D combined with weight-bearing exercise for at least 30 minutes a day. Maintain a reasonable weight and have your bone density checked regularly to assess effectiveness. Avoid overdose or prolonged supplementation without reassessing your needs. And most importantly, do not let arbitrarily supplementing calcium become a double-edged sword. Because after the age of 60, the balance between benefits and risks becomes even more fragile.